All right, Mr. Carter, you're recognized for 5 minutes.
Thank you very much, Madam Chair, and thank you for holding this hearing. Thank all of you for being here. We appreciate it very much. I have the honor and privilege of representing the 1st Congressional District of Georgia, which includes the entire coast of Georgia and a lot of rural area in South Georgia. As we say quite often, there are 2 Georgias. There's Atlanta and then there's everywhere else, and I represent everywhere else in rural Georgia. And I want to talk about but before I do talk about this, let me also mention, and this may come as news to my colleagues up here, that Georgia is the #1 forestry state in the nation. And I just want to make sure everybody understood that and knew that, and we are. But nevertheless, I want to talk about rural America because I think it's extremely important. Mr. Rodriguez, would you agree that the rural areas in our country have unique challenges when it comes to creating solutions to climate change, and it's essential that our rural areas have a voice in this process?
Well, definitely. I mean, excuse me, as a result of the climate change now, we've seen in your state, in Georgia, as well as many other states across the country, the increase in temperatures, especially during the harvest season times. And just recently, within the last 2 years, we had a farm worker die in your state as a result of exposure to heat illness. And the temperatures have risen. When we don't provide shade or provide drinking water, our supervisors and foremen and ranch managers are not adequately trained on how to deal with these particular situations, we have a really severe impact in terms of what's taking place with agriculture and agricultural workers in those particular communities. So yes, it's definitely having an impact in the rural areas in your state as well as many other states across the country.
Let me ask you, and I'll ask you and then I'll ask Dr. Bowl the same question, but should we be focusing on making sure that our rural hospitals are resilient and that they, especially to severe weather events, because we've had so many rural hospitals, particularly in Georgia, that have closed, and this creates a real challenge to our area. So is it important that we concentrate on that as legislators, Mr. Rodriguez? Would you, on our rural hospitals?
You know, definitely we have to be ensured that the doctors, that the medical facilities, that they're also very knowledgeable about heat exposure and the impact that it has on workers, on the lives, and what that can do to folks. And I know oftentimes we have not found that to be the case in particular areas and so forth. Now I think people are becoming much more, they're recognizing what this heat exposure does to folks, and they're dealing with it in a much more meaningful way in terms of avoiding further deaths of farm workers and folks within rural communities.
Okay, thank you. Dr. Bowl, what would you say in regards to our rural hospitals? How important is it that we make them resilient and that they are trained to deal with these severe weather events and make sure that we have these safety net hospitals?
Thank you for the question. We certainly have rural hospitals in my region. Though I practice in Cleveland, Northeast Ohio is home to many rural hospitals and also many communities who are challenged for access to care in rural regions. So to answer your question, I do think it's important that rural hospitals be part of the solution when it comes to resilience to some of these extreme weather events. When you talk about access, your comment about those hospitals closing and some of those impaired access for some of those communities, I think that gets into a much broader issue that may be out of scope for this particular group related to healthcare reimbursement and some of the financial pressures on those hospitals that are causing some of them to close. But from the standpoint of resilience and preparedness and training, as Mr. Rodriguez said, I concur that those points of access are important.
Just a general question, even to you, Ms. McCarthy. Do you think that we're directing too much of our resources to the urban areas and not enough to the rural areas?
I don't know if I have a good breakdown of what that allocation might be, but I totally agree with you that attention in rural communities is extremely important. And I know this committee has been looking at some of those issues, in particular with hospitals, and the fact that we have only one program, and that's at the CDC, that really helps both states and local communities to address hospitals and ensure that they're resilient. And so I would totally agree with you that we have to look at those issues. And I have not seen a great commitment on the part of this administration to do that. And it should be fully funded. There should be activity looking at where access is available, not just where the hospitals are resilient. There's something called a hospital stress test that I know folks have been talking about, which is great. It's an opportunity to look at what are we missing, what are we not thinking about, how do we plan for those extreme weather events, how do we have our supplies ready? And we've seen some of that work highlighted in terms of its importance with the challenges that Puerto Rico has faced,
Right.
which actually shut down medical equipment that impacted the entire country. And so I agree with you. This is a big deal issue, and it should be resourced effectively.
Great. Thank you very much, all of you, and I yield back.